What you gonna do? What you gonna do when
Carbon monoxide.
come for you, bad boys, bad boys? What you gonna do? What you gonna do when they
Carbon monoxide.
come for you? When you were 8 and you had bad traits, you go to
Carbon monoxide is a colorless, odorless gas that is produced when fuel is being burnt. Some of the most common sources of carbon monoxide fumes are cars or trucks, small engines, stoves, grills, fireplaces, or furnaces. Normally, the carbon monoxide produced from these sources is dispersed throughout the atmosphere and is not harmful to our body. However, when carbon monoxide is able to accumulate in a relatively small and confined space, this increased concentration can lead to carbon monoxide poisoning. Every year, at least 430 individuals in the U.S. die, and around 50,000 individuals visit the emergency department due to accidental carbon monoxide poisoning. Breathing in carbon monoxide fumes prevents the body from utilizing oxygen properly, which can cause damage to many important organs in the body. This breathing in of carbon monoxide fumes causes many flu-like symptoms, such as headache, dizziness, upset stomach, vomiting, and chest pain, which can be perceived as non-life-threatening. Carbon monoxide poisoning can rapidly progress throughout the body, causing confusion, unconsciousness, and death, making it a silent killer.
Let's pause and reflect. Affinity of hemoglobin for carbon monoxide is 200 to 250 times greater than that for oxygen. This means that carbon monoxide competes with oxygen for a hemoglobin binding site. Let's take a look at this visually. In this graph, the black curve represents how hemoglobin interacts with oxygen when carbon monoxide is absent. The red curve represents the activity of hemoglobin in the presence of carbon monoxide. The y-axis represents the saturation of oxygen on hemoglobin in the blood, and the x-axis represents the partial pressure of oxygen. If you focus on the black curve, you'll notice that hemoglobin approaches maximum oxygen saturation with an oxygen partial pressure after 60 millimeters of mercury. This pressure is the baseline amount. Typically, the partial pressure in the lungs is around 100 millimeters of mercury, so hemoglobin is fully saturated. When a single carbon monoxide molecule binds, one of the 4 binding sites on hemoglobin become occupied, resulting in 3 remaining binding sites on the hemoglobin. The binding of carbon monoxide changes how the saturation curve looks. If you look at the red curve, you'll notice that hemoglobin becomes fully saturated with less oxygen molecules. This is expected because there are fewer binding sites available for oxygen to bind to, and thus hemoglobin will not be able to carry as many oxygen molecules to its target tissues when it is fully saturated in the presence of carbon monoxide. Additionally, once carbon monoxide binds, it causes a conformational change of the binding sites that increases hemoglobin's affinity for oxygen molecules. This allows for hemoglobin to become saturated faster in the presence of a lower amount of oxygen once carbon monoxide is bound. This trend is shown by the red curve, which reaches half saturation at a lower partial pressure of oxygen. This is analogous to a reduction in Km from the perspective of enzyme kinetics. The consequence of the increased affinity is that once hemoglobin reaches its target cells, it has a harder time releasing its bound oxygen. Carbon monoxide's effect of decreasing maximum O2 saturation and increasing O2 affinity will result in suffocation of the cells because the total amount of oxygen that it can carry and release will be reduced. The energy requirement to maintain homeostasis in the body will not be satisfied in the absence of oxygen, causing eventual death in the afflicted individual.
Several sources of exogenous oxygen can be utilized to reverse the effects of carbon monoxide poisoning. Because carbon monoxide's binding affinity to hemoglobin is significantly greater than oxygen's, high concentrations of exogenous oxygen are necessary to decrease the formation of carboxyhemoglobin and shift equilibrium towards oxyhemoglobin formation. Depending on their oxygen concentration, these sources vary in oxygen's ability to outcompete carbon monoxide at the heme site, reflected by the half-life of carboxyhemoglobin. The half-life of carbon monoxide while a patient is breathing room air is approximately 250 to 320 minutes. However, while breathing high-flow oxygen via a non-rebreather mask, carboxyhemoglobin half-life is reduced to about 90 minutes, and with 100% hyperbaric oxygen to approximately 30 minutes. For this reason, hyperbaric oxygen therapy, which involves the inhalation of pure oxygen in a pressurized environment, is a common and effective treatment for severe carbon monoxide poisoning. Alleviation of symptoms is a result of increased oxygen delivery to tissues. High oxygen concentrations' impact on hemoglobin activity is twofold. First, oxygen outcompeting carbon monoxide at the heme site inhibits conformational changes in the other heme sites responsible for increased oxygen affinity. This way, oxyhemoglobin is much more likely to release bound oxygen to tissues. Secondly, oxygen outcompeting carbon monoxide increases the total oxygen carrying capacity of the hemoglobin protein from 3 atoms in the carboxyhemoglobin state to 4 atoms in the oxyhemoglobin state. Furthermore, with increased amounts of dissolved oxygen in the blood, the delivery of non-hemoglobin bound oxygen to tissues increases.
In this video, we covered the common symptoms of carbon monoxide poisoning and the effects that it has on oxygen levels in the body. All of these consequences can be avoided by regularly inspecting appliances and heating systems, using common sense with open flames, and maintaining carbon monoxide detectors in indoor settings. If you suspect that you have been breathing in carbon monoxide, remove yourself from the source of the gas and seek medical attention immediately. An exogenous oxygen supply could save your life from this silent killer.
That was close.
Bad boys, what you gonna do? What you gonna do when they come for you? Bad boys, what you gonna do? What you gonna do when they come